Hi, my name is Angela. I'm one of the nurses here, and I'm going to be going over your discharge instructions with you. Um, so glad to see that you're finally going home. I know this has been scary for you, so I wanted to explain what happened and what to watch out for as you recover. So you had something called amniotic fluid embolism, or AFE. What that is so your baby's surrounded with amniotic fluid, and what happens is a very small amount of that fluid or tiny cells from the baby or placenta get into your bloodstream. Uh, when that happens, your body can have a sudden strong reaction, and it affects your lungs, your heart, and the way your blood clots. It's very rare, and I want to be very clear here. You did not cause this. There's nothing that you did or didn't do to make it happen. Most of the time we cannot predict it. It usually happens suddenly during labor, birth, or shortly after. We see this a bit more in people who have problems with the placenta, or in very fast or very difficult labor, a C-section, or certain procedures during birth, pregnancy at age 35 or older, and or several past pregnancies. So, but even with these things, AFE is still very rare. During AFE, we often see sudden trouble breathing, chest pain, or feeling like you can't catch your breath, feeling weak, confused, or like you might pass out. Sometimes there's seizures, heavy bleeding after delivery because your blood's not clotting right. But the team here moved very quickly to support your breathing and blood pressure and got the bleeding under control. Sometimes patients need to be in the ICU or have a blood transfusion. Because your body went through a lot, you might, when you get home, you might notice that you feel very weak or tired. You might have shortness of breath, especially when you're being active. You can have chest discomfort or a racing heart, swelling in your legs, trouble with memory or concentration, strong emotions like fear, sadness, anxiety, or nightmares. The time to get help is if any symptoms are worsening, or you feel like you're not healing properly, having an ongoing trouble breathing, or if you're having chest pain, heaviness or pressure, if you feel like you might pass out, have new weakness on one side, trouble speaking or sudden confusion, if you have very heavy bleeding. So watching the bleeding on your pads, like if you see that you're soaking a pad in less than an hour's time. You can call your doctor or midwife the same day if you're noticing that your bleeding is getting heavier, you have worsening shortness of breath, leg pain or swelling, fever, chills, if you're feeling very sad, anxious, numb, or unable to sleep. Self-care and follow-up advice. Make sure you're getting to all your follow-up appointments. Rest. I can't stress that enough. Make sure you're accepting any help that's offered with cooking, cleaning, anything that's helping you with the baby. And just watch out for any changes in your bleeding, breathing, or energy level. Talk about your feelings with someone you can trust. Let your provider know if your mood stays very low or if you stay anxious. counseling or support groups can really help. If you become pregnant again in the future, your care will likely be in the high risk clinic, where the team can watch you closely. The chance of this happening again is believed to be very low, but your providers will plan carefully. So at this point, I would ask my patient some questions to make sure she understood everything that I said, and we're on the same page. So I would ask open-ended questions, like asking her to tell me in her own words what amniotic fluid is, or I'm sorry, what amniotic fluid embolism is, times that she should call 911 or get to an emergency room. I would ask when to call the doctor or midwife. And I would ask her to tell me one thing that she could do at home to help her recovery. And then I would end it by saying, if there's anything that you can think of once you get home that I didn't go over, or any questions that you couldn't think of right now to ask, because I would ask if she had any questions for me, and if she said no, I would make sure to say this, like, when you get home, you think of anything, don't hesitate to call. I would give my name, my extension number, and just tell her there's always somebody she could call for anything she's confused about or worried about, to just help her recovery be a lot better. And this concludes the discharge teaching video. Thank you.